You have the skills. You have this highly skilled doctors, highly skilled nurses, healthcare workers.
Well, you'd have
That's
to deal
all in
with
place, but
unions
then
would
you have
say,
to deal
"Oh,
with
well,
the
we don't-"
unions.
Well, they have to deal with the unions, but, okay. Are we here to serve patients or are we here to serve unions?
We're here to shorten waiting times,
No.
and every politician, one of the things we're here to do.
The thing that really hit me in the face, bingo, as I said to you, isn't the fact that we're spending a lot of money on healthcare. We're rich. We could spend more, no problem. It's that we don't get value. And you look at these international surveys that are done which compare the performance of public healthcare systems, and I take no pleasure in saying this, whether it's the OECD in Paris, whether it's the Eurobarometer, whether it's the Commonwealth Fund, our system is in the middle at best.
At best. So you go to Sweden.
Yeah.
What's different?
We all think of Sweden, and correctly, as the classic social democratic country, and I've always had a high regard for Sweden. About 10 years ago, everything was delivered by the state. The state owned the pharmacies, they ran the schools, they ran the daycare, they ran the health, they paid the doctors. That was socialism, social democracy. 10 years ago, they said, we got to blow this open. And what they've done is they've created a competitive model within each of these public services. And the money from the state's paying, follows the student who might want to go over to this school that was created by a group of privately organized folks, or to that daycare center that might be privately organized, or to this family clinic with privately organized physicians, or this group of specialists over here. So they've set up a model where the state provides, but private suppliers also compete for public money. And if you're a patient and you're on a roster of this public family clinic, and you decide to go across the street to this family clinic, then you carry on your head a certain amount of money as a patient, which then goes to the private clinic. And the public clinic, this is the theory, says, geez, we just lost Fanny. We better pull up our socks and try to get the Fannies of the future to stay here. So they think it improves quality by having this kind of competitive model within the public system.
Well, one of the arguments for public-private healthcare, isn't it? That it's more innovative. Competition stimulates, innovation stimulates.
The biggest single problem we have in discussing Medicare in this country is the word private. There's two kinds of private. One, you pay. You reach into your pocket of your purse and you pay, or you buy private insurance. The other is somebody organizes themselves privately to deliver a service within the public system. The public system pays. It signs a contract with a clinic or with a diagnostic testing operation, and they provide service, and the public pays.
Okay.
Now, in other countries, and I just gave you the example of Sweden, this is the norm. In Canada, because of this whole ideology around the word private, we discourage that. And when clinics try to open and doctors try to organize themselves that way, all hell breaks loose.
Well, Dr. Brian Day here has been fighting the fight a long time.
But he's doing both. He's doing both. Give me some workmen's compensation board cases for which the state will pay. I'm a private physician with my clinic. And also, if you want to come to me and pay me, I'll do that too.
I see, get ahead of the line.
He's got both going at the moment.
So I have a sore knee. I have a knee that simply doesn't work, and I want it done now, and I have the money to do it. I can go to him.
Pay. And the Supreme Court of Canada said that that was all right. Now, we haven't seen an explosion of those kind of treatments. I'm talking mostly in this book about creating a system whereby you can take things. We have to dehospitalize system. The hospitals are stuffed, but they're being asked to do things they shouldn't be asked to do.
And there are bed blockers,
Lots of them.
As you talk about in the book. Bed blockers, people who are in hospital because they have nowhere else to go.
So you say, well, what are we going to do about that? Well, the standard answer is let the state build more nursing homes and long-term care. Okay, fine. And when are they going to get the several $1 billion that they need to do that? Not easily or quickly. So I say, if you're really interested in getting a grip on this problem, you drop the ideology and you say, let's sign partnerships with private interests who will build the buildings, sign contracts with them to treat X number of patients, you regulate them, you monitor them. If they don't live up to the standards, contracts canceled. That way you're going to get things built faster, and you're going to be more helpful to patients, and you're going to move more of them out of hospitals where they cost you money.
Yes, because as you know, I know 3 days in an emergency is too long. There's many complaints, but
Well, we have the longest wait times in the world. I mean, I'm
Yeah.
sorry, we do. And that's, we need to do three things here. We need to try to improve quality, which is good, but we can get it better. We need to try to deal with this access problem, and we need to try to start bending the cost curve. Otherwise, we're going to suffer all the other programs being cut, which is what's been happening in BC and in other provinces.
Oh.
And if somebody wants to deal with that, Fanny, by saying, we will raise taxes, that's at least an open and honest thing to say. You have to watch two things, though. We've charged money into the healthcare system from about 2004 until a couple of years ago. Where did the majority of the money go? To the providers, to the nurses whose incomes went up twice the national average of other workers, and doctors whose incomes went up 3.6%. So be careful what you ask for in terms of more money. And also, just to finish, the other thing to be careful about is,
I'm not letting you go, we're just taking a break.
yeah, okay.
So you can finish when we come back. And Canada is suffering from healthcare myopia, according to him. Jeffrey Simpson, our guest, chronic condition, why Canada's healthcare system needs to be dragged into the 21st century.